Yes, it's another beautiful Wednesday morning on our program Midweek Connect. And of course, we know it's a program that we do x-ray what happens in the society as they concern you and I. And this week is a special edition. And what we have for you this morning, looking at Edo State, since the inception of this administration, Governor Mondo Pewolo, we've had so many things happening in all sectors, and our focus this morning will be on health sector. What are these giant strides? What are the things happening in this particular sector? And of course, you know, when we talk of sectors like this, we have somebody that is at the center. When we are talking about health in Edo State, we have a commissioner that is seeing their phase of things, how things are carried out in line with the programs and activities of government. And so we are so happy to have in the studio this morning the Commissioner for Health here in the state. He is Dr. Cyril Oshomole. So you're welcome to the studio. It's a privilege. It's like this is the first time we're having you.
Exactly. Yeah.
We've always been looking forward to having you.
I think he's the first commissioner this year
to have to feature for this program.
Yes.
You're welcome, sir. Thank you, former. Yes, my co-presenter.
Good morning. Good luck. You're looking good as usual.
As usual. It's another day.
A week, yes, a week of another discussion on topical issue, and you know how germane the issue of health is.
Yes.
A healthy man is a wealthy man. When you're healthy, that's when you can do so many things.
Of course.
And we are so privileged to have the commissioner pilots the affairs of the when it concerns health sector. And of course, just like you said, the state government is doing a lot when, you know, holistically when it concerns, and we're bringing touchlights on health.
Thank you so much.
Welcome,
yes,
sir.
Dr. Cyril. We are looking at the health sector. First of all, we know that when the governor came on board, he made his appointment and he found it worthy to occupy this position. Looking at the reforms and programs of government, what were these programs and reforms you met on ground as a commissioner, and how did you kickstart with them?
Yeah, thank you very much for having me. Like you all know, you said health is wealth. If you're not healthy, we can't do anything. When we came on ground, there were so many gaps that we found, and we had to start borrowing. That's why first few hours after the governor was sworn into office, he nominated me as the Commissioner for Health. It was almost a record-breaking appointment because that was the first time the governor was sworn in the same day, at the same time swearing in a commissioner that same day, and giving the commissioner a portfolio. That to show that the importance of health is cannot be overemphasized. And you know, for the Chinese agenda, H is health. We came into system 2024, approximately almost a year and a half ago, and from the first day we started work. There's so many things that we found, and when we started working immediately, that's why the first 1 year in office we had to revitalize 61 primary healthcare centers. As you all know, for you to have a very strong health system, the foundation must be strong. You cannot build a building without a solid foundation. And in terms of health, the health ecosystem, the primary healthcare center is the foundation and the rock of that foundation of health. Currently, we have renovated 61 primary healthcare centers across all the local government, 18 local government on the state. We've also equipped 30 of that 61 primary healthcare centers. We also work in collaboration with some NGOs, non-governmental organizations, and foundations who are on their own, helping us to renovate some of these PACs. There's another very important aspect that we often neglect, and that has to do with the medical oxygen. You cannot have a very robust, strong health system if your oxygen supply is not robust. So we have commissioned 2 oxygen plants. We commissioned the first one in Auchi General Hospital to take care of Edo North. We also commissioned another oxygen plant at Uselu for Edo South. That will take care of the Edo Senatorial South District. Like I said, oxygen is very vital for any health system. When you have a medical emergency, most times you need oxygen, and the federal government have mandated that for every private or government-owned hospital, you must have minimum at least 2 oxygen cylinders, and you must tell us where you get your oxygen from, because it's very, very important. We've seen cases of people are rushed to the hospital and they die due to lack of oxygen. They don't have inadequate oxygen supply. So because of this, I know during the COVID-19 pandemic, it exposed a lot of gaps in the healthcare system, and that was the reason why the federal government thought it was need for us to close that gap, and that translated to this 2 oxygen plan that we commissioned, funded by Global Fund, in partnership with the state government, and so many other things that we've done so far. You're talking about data management. You need data for transparency, you need data to plan, you need data to forecast, and that was why we were able to distribute 200 laptops and tablets to our PACs, like I said, to straighten data. We also gave out 18 ultrasound at the level of the local government. As you all know, Nigeria has one of the worst maternal mortality and neonatal mortality and infant mortality globally. In fact, in terms of absolute numbers, Nigeria is the highest globally. In terms of rate, Nigeria is the 3rd in the world. Like we said, every day about 200 people will die due to pregnancy or pregnancy-related issues. So on account of this, that's why we're able to give an ultrasound, so we're able to detect pregnancy on time and reduce the level of delays. We also went as far as also training our healthcare workers. In fact, we're able to publish a paper recently, and it was accepted in a journal for us to see how the relationship between providing this point of care at the primary care level. You don't have to wait to go to general hospital or a tertiary center. At the primary care center, when you have ultrasound, be able to detect complications on time, and by extension have the means of reducing maternal mortality. Like I said, we've done training and retraining of our workers in terms of IT, laptop and computers, in terms of structural, we tested 1 PACs. Even our specialist hospital, we came into office, there was no single ventilator, and within a few months we were able to procure a ventilator for the hospital. So the Basenja Hospital, we're doing a massive work currently, massive work. The governor has about billions of naira to continue the second phase of the Basenja expansion, because we know it was commissioned but it was not really functional, and there's so many things that needed to be done: equipment, administrative block, OPD, theater. So as we speak, there's ongoing construction in Basenja. But looking at those central, the governor also is currently building the nursing school and the general hospital, by 100-bed general hospital. Is going to be very massive. It's going to be like a 5-star hospital. These are very big and bold reforms that the government is doing to tackle the health issue, because for a society to be strong, we need to have a strong health system. And of course, recently Benin City, which is the only city in Nigeria and the only 4 cities in Africa out of the 24 cities globally that won the Global Mayor Prize. It's a $1 million prize. Of course, everybody knows.
Commissioner, I think this second phase of what you're trying to say is on its own, is independent of on its own. So can we just deliberate on what he has already said so far, what the government has done, before we will now talk about this second phase of doing, because it's on its own, it's standing on its own.
I did hear you talk about maternal mortality, and we know that
there's one important point I've not which is very, very important.
The healthcare.
Yes, Nigeria accounts for about 31% of the global burden due to malaria. Let me say 31% of deaths due to malaria globally in the whole world. So that means that malaria is a very serious issue in Nigeria.
Of course,
that accounts for majority of maternal mortality and infant mortality. So on account of this, we are currently doing a 2-year program of free malaria treatment and testing in all government hospitals. You know, we have about 400 and about almost 550 government hospitals in the state. So every government hospital in those states have that program: free malaria treatment and free testing. Of course, in 146 of our primary health care centers, we have what we call Basic Healthcare Provision Fund, which is 1% of the federal government consolidated fund. They have a lot of what we do there. We have on the fives free for them, for pregnant women free for them, for the elderly free for them, also for the indigent patient free for them in 146 PACs across the state.
Okay, so it's up to 100. Okay, 146. And you see, most times people, you know, people. Yes, I want to talk about awareness,
citizens.
Because
what's the feedback you're getting from people that are really?
146. I'm even very surprised because if you go to secondary, talking about primary health care, if you go to secondary health care and tertiary, like to the teaching hospital and secondary health care, you see so many patients and their relatives, you know, besieging this tertiary institutions, and is having strain on these few personnel in this institution. So I wanted to ask that question of awareness, because
how are people keying into this
146 against 18 local governments in Edo State is large. It's
maybe one of the reasons why people go to the general hospital, because, for example, the central hospital, UBTH, for the indigent patient, those who cannot afford to pay for cesarean section, is free for them under the MAMI project. And this is because of the high, like I said, Nigeria accounts for the highest maternal mortality in terms of absolute numbers, and we third in the world in terms of rates. So because of that, we want to crash it. That's why we have the CMOC for free cesarean section, UBTH inclusive, central hospital inclusive. In fact, we are about to kick off for those specialist hospital, and very soon when celebration will open, we also roll it out. So these are some of the reasons why you see the people queue up there, because you cannot get some of these free services in a profit-driven private hospital.
Hospitals, yeah, of course.
So these are some of the push factors. But we tend, by God willing, when we start operating in Nta Benin, it will actually
reduce the surge.
Yeah, the surge, because then we'll be able to take care of some of those patients.
So far, many people have benefited from these activities. You're talking about, have there been statistics so far? You started talking about the free cesarean, you talked about malaria program and everything. What's
the malaria? In fact, the malaria, from the feedback from the recent research that was done recently, the malaria burden of Edo State has actually reduced on account of this free malaria program. We got some experts from University Hospital Ibadan. They came and took some samples. You know, we have people who are specialized in insects. They came and took some of this Anopheles mosquitoes and all that, and did some research. So because when we started the program, there was research before the program, after the program, and we are going to this is the second year of the program already. So people can have access to free malaria treatment to reduce the financial out-of-pocket expenditure for them. So I think the government should be applauded for that. Like the 146 basic healthcare provision fund centers at the primary care level across the 18 local government. I think what we need to do is more sensitization, like what we are doing currently. I don't have a TV channel, but NTA can help us tell our people that when you have malaria symptoms, but not for typhoid fever, not for diarrhea disease, but for malaria is free.
But you're talking about a 2-year window. What happens after this period?
Let's see the 2 years, and then we make an assessment as to see if it's worth it. If it's worth it, you know.
Okay, Doc, I want to come in and ask this issue of, personnel is also, though you talked about training and retraining of personnel, you know how important it is in healthcare, talking about healthcare. So, but my question now is how, looking at this brain drain of medical personnel, medical doctors, nurses, and other medical personnel, the exodus of them moving to other countries. So how do you see it affecting healthcare system in Edo State?
Yeah, I always tell people that globally we have shortage of doctors. Even the US, there are some states now who are beginning to amend their laws to make it easier for doctors to practice. So there will always be migration. People migrate from Europe to the US, Europe to Australia, and you cannot stop migration. What you can do maybe so.
So what the state is doing to attract them, to make them not to move?
You cannot even do that because there's nowhere in the world where you can stop migration because of globalization. People can try to work anywhere they want.
Yeah, but the attraction, most times when you talk to them, that brain drain doc, they always complain about remuneration, working environment, lack of equipment, and other gaps in the healthcare system that push them away. So my question now is underlined on the issue of what are the attractions you feel the state you as you are the right personnel, a key player in all this. You're a medical doctor.
Yes.
What are the attractions that you feel the state can do to make them not to stay behind, to stay back?
Yeah, like so that's my constituency. Yes. A medical doctor. What we are planning to do, and the governor agreed, is for us to increase remuneration. Because that's a major push factor. When you increase the salaries, you make the working environment conducive for them, and that's why we are procuring equipment, and we continue to do that. And just like my neighboring state just increased their salary by 200,000 across board.
Which state?
Delta State. The problem we have in Edo is that we have 5 federal government institutions. It's supposed to be a blessing for all, but somehow it's causing problem for all because there are internal migration from the state hospital.
Okay, from the state hospital to federal hospital
because of the higher pay. So what we tend to do is to close that gap. So anywhere from now, you're going to hear the announcement. I've discussed with the governor. Is willing to do that. Because that will be one of the immediate factors. Secondly, we also want to retain the very skilled, experienced ones who are about to retire by increasing the retirement age to 65.
Commissioner, I did hear you say one time that what government seeks to do in the health sector is to make healthcare affordable and accessible to the people. To what extent, coming on board, have this been achieved? How accessible and affordable is healthcare to the people of the state?
Thank you very much for your question. In fact, the question is how affordable. That's the most important thing. Affordable, accessible. Accessible, of course, maybe you have to build roads and all. That's why health is not just isolated. You work with Ministry of Environment, works, water, because you need the water and all that. In terms of being accessible, now we have free malaria treatment.
Affordable.
That is even free. We're not talking about cost now. It's even 100% free for malaria treatment and testing. For the 146 BACPF, some of the activities, a lot of the activities are free, especially for the under 5s, for the pregnancy, for the indigent patient, those who are above 65 years. We have a lot of free services for them. Because you talked about accessibility, now I'm giving you reasons why they're just affordable and also accessible. So these are some of the things we came up with. We look at those who are the vulnerable groups, the elderly ones, we give them free for the BACPF. For the pregnant women, we give them free antenatal up to free delivery. Uncomplicated delivery is free. And for those who have maybe they need to do cesarean section, like I do for the general hospital, because we have to refer to general hospital that does cesarean section. For that one, for the indigent patient, for those that can afford it, you can afford it. For those who cannot afford it, cesarean section is free for them, including UBTH. Central Hospital, very soon ESH, because there are some criteria that we have to meet for us to be on board. So
talking about teaching hospital, doctor, is it that the state works in collaboration with?
Yes. Health is, you cannot say because you have malaria. Health is something that is across everybody. We are all in it together. There was an outbreak now. The outbreak will not say, I'm not going to affect teaching hospital. So we work hand in hand, and we have a very good relationship with all the federal government of the states.
All right, Doctor, we'll continue the conversation, but let's take a break. We'll be back shortly. Please stay tuned.
Good morning, sir.
Do you live in Aduawa and environs, or you need a conducive and open field in Aduawa for your wedding receptions, birthday parties, annual ceremonies, family or corporate events in a serene and conducive environment that is close to nature? Then look no further. NTA Benin Aduawa is a place for you. NTA Benin Aduawa has a large field for all your events and ceremonies. Also, at NTA Corporate Headquarters TV Road, we have a state-of-the-art fully air-conditioned ultra-modern hall for all kinds of indoor events with a standby generating set, therefore ensuring uninterrupted power supply. We also have NTA Pavilion for all outdoor events at the same venue. Guess what? Our prices are affordable, locations are easily accessible, venues conducive and highly secured. Our outside broadcast van is available 24 hours and can broadcast your events live. And above all, you can air your events on our award-winning program like Events and Style. And any booking on the field or halls gets a bonus of free news coverage. Wow! What are you waiting for? Grab this opportunity and have your celebration in a grand style. For inquiries and bookings, please call NTA Benin, the award-winning station.
Brokia, otherwise known as Waka.
Yàwó sẹ́lógbé yẹ̀wò sẹ́lógbé yẹ̀wò sẹ́lógbé yẹ̀wò.
This is Health Plus. Today, searchlight on universal healthcare. What does it mean?
Diphtheria is a vaccine-preventable disease. It is highly fatal.
It's good to sing praise unto our God, for it is pleasant and praise is comely.
Hello and welcome to another exciting episode on Youth Arena. I can't wait to hear what you guys have in store for us today. So if you want
the Holy Prophet Muhammad sallallahu alaihi wasallam.
Hey there, welcome to another exciting episode in Charles and Jams. It's your girl Pearl.
I just took a shot of whiskey, get you some energy. I tell myself say I know go cry, but I
Yes, if you're just joining us, it's still Midweek Connect on NTA Benin, and of course we still have the Commissioner for Health Edo State, Dr. Cyril Oshomole, with us here, and so far he has enumerated the strides recorded under the administration of Governor Mondi Ipolo, with him at the helm as far as the health sector is concerned in Edo State. And to further talk on this health sector, the giant strides. But before we go into that, I want to let you know that you can call into the program to ask questions, share your thoughts, and engage the commissioner here. The number to call is 0703 695 7086. I repeat, 0703 695 7086. If you do you have the second number?
Yes, 081 090 42 594. 081 090 42 594.
Thank you so much. We are still talking about giant strides in the health sector of Edo State, and we know that as a commissioner is here, Commissioner, we know a lot of things have been happening, achievements in this health sector under your watch. And recently we had something that came into the state. I think they call it the blue bag.
Okay, I challenge.
Yes. I don't know what really prompted that award, what the state government had to do to be part of this initiative. How significant is it to Edo State?
Yeah, thank you very much. I want to applaud my team under the Ministry of Health, Edo State. Initially, over 6,000 cities competed for the Mayor Bloomberg Prize globally. Mayor Bloomberg was the mayor of New York. He's currently one of the richest men in the world, worth over around $10 billion with an annual revenue of $15 billion. The challenge is a global competition platform. So when we competed for that prize, From 6,000 to about 635 cities were shortlisted. After which later on up to 50 globally were shortlisted, and we scaled through the top 50. We had $50,000.
Okay, I think we have a caller. We have a caller here. Sorry, Honorable Commissioner, you continue. We have the caller. Yes, good morning. Your name and where you're calling from?
Good morning. Doris is my name. I'm calling from Aduwawa.
Okay, thank you, Doris. Please, can you go on? You have a suggestion or you want to tell us?
I want to ask a question. I understand that recently Benin City, the Edo State capital, won the Bloomberg Award. I want to know how that award will impact the lives of citizens, because I also understand that it will be used to combat maternal and infant mortality as well as malaria. What is the implementation going to look like? What agenda or blueprint does the commissioner have to do this?
Okay, thank you so much, Doris.
He's been trying to talk about it. So
thank you so much, Doris.
It's a kind of
the commissioner, you can hear.
We're looking at how significant is it to the state, and probably how will it benefit
the
citizens of the state.
Yeah, that's what I started by saying.
Yes,
that,
you started some.
maternal mortality in Nigeria is the third in the world, but the absolute numbers, Nigeria is the highest. Imagine Nigeria having about 7,000 deaths every year. In a day, about 200 women will die of maternal mortality. Every 8 minutes, one person will die. So it's a huge problem. So Nigeria accounts for every 5 women that dies. Nigeria accounts for like 1 out of every 5. So Benin City has a population of about 2 million people. And for the reproductive age group,
Commissioner. Yeah, good morning. Yes, caller, what's your name? Where are you calling from?
My name is Daniel. I'm calling from Benin City.
All right. Can we hear you?
Everyone in the studio, especially Commissioner of Health. My question is this. On the youth sector, I've noticed that a lot of there's brain drain in the health sector. What I mean by that is most of our doctors are traveling out from greener pastures, and that is a signal to the fact that the remunerations being given to these doctors are nothing to write home about compared to what their counterparts are getting in other countries. So what is the solution to it? Because recently, not too long, the union, the health sector union, talking about the resident doctors went on strike because they were clamoring for higher wage payment. What is the solution to it? I want the commissioner to provide a solution to it. Because most of the doctors we see now, some of them they are student doctors, especially when you go to GSM and PTH, you have experienced doctors and consultants. Even some of them will have their own specialties where they want to refer you to. And again, there's another question I want to ask. When a doctor go against the, I don't know how to put it now, the ethics of the profession, are they routes that someone can take to kind of for the doctor to be penalized? So those are the 2 or 3 questions I want the Commissioner of Health to attend to. Thank you.
Thank you so much. I think the commissioner did address that issue of brain drain because we raised it here. Yes, but there's a second thing he's talking about when a doctor goes to the contrary.
I understand what he's saying.
We
always want to improve remuneration. We want to also reduce performance bonus allowance to help to encourage them. Talking about consultants in UBTH. A doctor is a doctor. We don't want to like student doctor. Whether you're a medical student or you are a licensed practicing doctor. Consultants are over 200 in UBTH, are the largest in the state. Some consultants have their days of clinic, days of ward round every day. They have so many. They have this for surgeons, they have this for surgery, they have this for clinic. So it doesn't mean because you come to the hospital, you don't see the surgeon doesn't mean that the doctor is not working. So we have the medical officers, the general registrars, senior registrars, and of course the consultants. So that's the way these things are done. People might not really understand. The doctor who have a license is a doctor. If you're talking about medical students, those ones they are learning. But once you're a doctor, you're a medical doctor, because they've gone through so many years of intensive training. So it would be unfair to look down on them that they are kids. They are doctors. Then in terms of this new Blueberry,
the first caller talked about the impacts and also the implementation.
That's why I want to run with it. Is this something that will come handy to the state government?
That is why I want to make an emphasis.
Okay.
Nigeria has the worst in numbers. In fact, BBC said Nigeria is the worst place to give birth on earth. So it's a very huge problem for us. So this is something that we need to celebrate, because by the year 2050, according to United Nations, Nigeria will be the third most populous country on earth, accounting for over 400 million population. So we have to.
So it will be a strain on the health sector.
It will be a strain on the health sector, economy. We need to scale up a lot of things, because I don't want to be. But in terms of this, that's why family planning is very, very important. There are 4 things. When the pregnancy is too early, there are too many, they are too late, they are too close. They all cause complications. Because when you have early pregnancy, teenage pregnancy, and when you have lack of family planning, these are high risk pregnancies. So with family planning, it had been shown by data to reduce maternal mortality to up to 30%. So when we have
30% is
over 200 women dying every day, it's like an aircraft of 200 passengers crashing every day. That's cause for an emergency situation. So for this one, Benin City was the only city in Nigeria, the only 4 in Africa, and then the only city among the 24 globally. In fact, on the list, we're 5th on the list. This Benin City accounts for 2 million population, and the reproductive age group is about 550 in population, and Benin is among the top 5 to 6 most populous city in Nigeria. Now, with this Blueberry challenge, we have community and neighborhood kiosks. So bringing healthcare closer to the people. And then we have reproductive activities there, reproductive health activities, family planning activities. Like I just told you, family planning, one of the fastest and safest way to crash maternal mortality.
Up to 30%.
Yes, and we also have community. We're having community outreaches. We'll be having digital referral, because when you come, you have to refer to the right place. We're always being told that the best doctor is the doctor that knows when to
refer. Because talking about mortality, that maternal mortality and infant, I mean the top on the chart is that referral. The need for referral,
very, very
not even personnel or equipment.
It's very, very important. It's very important, because they're going to have an app for digital referrals. So, and this community kiosks are going to be, and thankfully for them, these things are being closely monitored and managed by the UNDP. The money does not come to us, so everything will be procured through because they have the standardized global procurement standard. Working with the local government chairman, because Benin City has about 5 local government that make up Benin City, we have to choose one out of that 5. So currently they are always having Zoom talk with the people in New York. In fact, they'll be visiting the second time. They'll be coming to Edo State to see how we're going to implement it. But there are some requirements.
It's one thing to have it. It's like Nigeria, a lot of times being said implementation is our challenge. So how are you going to monitor this implementation?
They are the one that are going to monitor it.
So what will be the activity of government in ensuring that these things is really
they will be the one to ensure that this thing is done. So there will be transparency. There is transparency. We have to follow their request.
So what part of government, the ministry, or
what the state government will do, but at this level now is at the level of the local government, the non-state government. It's a local government affair. So they need to also make some commitments before some of these things are achieved.
What are these commitments?
They will pay, like some of this staffing now, we need to get some extra staff to man this community kiosks. And the Bloomberg have decided to pay some stipends to these healthcare workers. Then they also require us at the level of local government to also do our own contribution, kind of counterpart funding. But before now, these criteria were not there.
Okay.
I think they want to see if we can sustain it beyond this program. Because we promised, one of the reasons why we actually won, we told them, because they came, they met me, I told them that this government is committed in terms of healthcare system, that we even have one of the biggest budget in terms of health. They were impressed. I told them to the deputy governor, and they wanted to make sure that if we win this money, are we going to continue this project beyond
exactly
the question, and we promise we will do that. So they want to see our commitment first. So if, for example, they are going to bring 100 naira, maybe we will bring like 20 naira or 30 naira. So that's what we are still talking. So they are very strict when it comes to demand of their funds, and they don't just give out their funds, they give it to UNDP. Why UNDP? You do all the procurement processes.
So right now is at the preparation stage. It's not yet time. We are still looking around it, how it's supposed to be done, the model and everything.
Currently, my team and the local government chairman is in talks with the philanthropists, philanthropists.
Hello.
And they have their requirement that we have to
meet. Good morning. I think we have a caller. Yeah. Well, your name and where you are calling from?
Okay, my name is Jane. I am calling from Ring Road.
Okay.
I have a question for the commissioner. Sir, before I ask my question, I want to say congratulations to Edo State for the international award.
Thank you.
It's not an easy thing at all. The Ministry of Health in Edo State is really doing good. But sir, there is this observation I have, I have in this state. Anytime there is an outbreak of an epidemic or disease, Edo State is always there. For instance, when there was an outbreak of dengue fever, Lassa fever, Edo State was there. So I don't know what the state is actually doing, the Ministry of Health in particular, to make the environment clean, because I feel one of the reasons Edo State is always there is the state of the environment. The markets are not clean, some of the roads are not clean, so I don't know if the Ministry of Health can do anything in this aspect to make Edo State cleaner than this. Thank you.
Thank you very much. Talking about the indices around the health sector, a lot of times a healthy environment promotes health.
Yes.
I don't know if there's any collaboration with other.
The issue of outbreak, you have to look at the way Edo State is situated. Edo State linked the north to the south, so there's traffic. It's a gateway. So that accounts for those outbreaks. So in terms of environment, it's not just Edo. It's a global issue. Now, talking about dengue fever, for example, and diphtheria and all that happened last year. If you go to WHO website, you will see where WHO commended Edo State Ministry of Health for their proactive measures to curb that dengue fever outbreak. In fact, if WHO can give us that commendation and on their verified webpage, so that means we are not sleeping. If WHO can actually acknowledge what we are doing in partnership with the Nigeria Center for Disease Control, we are doing a lot. Our community health workers, our health educators go to the market square to talk to our people, because most of them believe that rats have been with us for millennia. Why all of a sudden we are saying that we shouldn't eat rats and all that? So it's something that we need to keep talking, trying to explain to our people that
to influence them for a change.
Yeah, because there are some communities that believe that they can eat rats and they've been eating rats, they've not been in that.
Of course.
So why are we complaining? But we don't give up, we keep talking, and also we learn and unlearn old bad habits. We are doing our best. We know recently even there was a court injunction that the state government have no right to mandate environmental sanitation.
It's an infringement on the right of people, but
the government wants to, so I am among those that say, okay, if it comes to that, I think we need to do it. Mandatory environmental cleaning.
I think that will even
she's saying a very valid question, but when the government wants to force it on people now, the same people will complain that
it's too much on them.
Yes, so
the whole thing is that between government and the people, government should play their part equally. Citizens should also, when we are talking about the health sector, having health care and all that, it's not just the responsibility of government.
In fact, recently
everybody has a role to play.
Recently we did a task force. I'm the chairman of the task force for fake fake drugs and adulterated food. And we have market women who are members of the task force, the EAK rep, member of the task force, the cattle rearer, member of the task force, the livestock association, member of the task force, Ministry of Environment, member of the task force. So, and we are talking to them. Keep your market clean. We are doing our best. So this thing is not only for government, it's for everybody, including the color that called. We need to, but government cannot do all, but we need the cooperation of everybody. If our environment is clean, we live in a healthy environment. By extension, we'll be healthy.
Yes, so closing thoughts, we don't have the time. By way of closing thought, we know that from what you said, a lot is going on in this under this administration and in the Ministry of Health. So what are your closing thoughts the people should look forward to? As I know that this government has some time before it wraps up the first administration, and you're still at the helm of affairs. What should people expect, and what is government equally expecting of them?
Yeah, we want to thank the people for giving us that trust, for voting my governor, Senator Mondo Pogolo. We have a social contract, and we want everybody and indigenous to take this as their own, to take ownership of all our programs, of all our PACs. You are surprised that we do all these 146 PACs providing free services in terms of under 5s, pregnancy, indigent, and 65. So people should take ownership of this program. You go to our centers and you have malaria, make them know that you have the right to have free malaria and free testing. So we should take ownership of every health activity in the state.
So any number people can always reach out to when they need to talk and maybe share their health experiences.
I'll give you the number after the program. My phone.
All right. Thank you so much, Commissioner for coming to the studio to share your thoughts and what is really happening in the health sector in those